Hello everyone watching. My name is Michelle O'Keefe and I'm a clinical psychologist with a background in long-term health conditions and in particular cardiology. Today I'll be presenting on the psychological impact of a cardiac condition. The information I will share is drawn from research, themes that have come up time again in therapy sessions, and from my own experience of living with two long-term health conditions. You will also see quotes from patients that have resonated with me and perhaps may resonate with you. So in terms of the overview, the talk will provide information about the process of adjusting to a heart condition, potential psychological challenges, common emotional, cognitive and behavioural responses. Coping strategies will be referenced throughout the presentation, and finally I will speak to the support options that are available. This presentation is intended for people with all types of heart conditions. It won't cover every aspect of the subject, and not everything that I talk about will apply to everyone. But my hope is that it will provide you with some helpful information and point you in the right direction if you feel you would benefit from accessing psychological support related to your heart condition. Having worked with people with heart conditions for some time, I've learned that there are ripple effects of the heart condition on many, if not all, aspects of life. As a result of these ripple effects, over time, some people can end up viewing their lives through the lens of their heart condition, and it can feel as if it's taken over. I'm mindful that I'm about to spend the rest of this presentation talking about the impact of a heart condition, and of course this will keep it centre stage. However, within this talk, I will also provide some information about how to manage these impacts so that you can have some ways of managing the ripple effects and take the glasses off from time to time. So I'm going to start off by talking about the process of adjusting to a heart condition and the different factors that can affect this process. These include diagnosis, so the nature of your heart condition, prognosis, what you can likely expect from your type of heart condition, and the tests and treatments that may be required in the management of your cardiac condition. So in terms of diagnosis, being told that there's something wrong with your heart will be difficult to hear no matter how you find out. However, the manner in which you find out this information could affect your experience and response. If you were born with congenital heart disease, you may have always known yourself as someone with a health problem and had to adapt to living with it early on in life. Your parents may have taken the lead on managing your health, and when you were older, you may have transitioned to adult services. The adjustment to being more independent might have brought with it challenges and taken time to get used to. Some people might receive a sudden diagnosis. In these cases, the diagnosis might come as a shock, and you may feel overwhelmed by it and having to absorb complex information and potentially make challenging decisions about treatment in a short period of time. For others, they may have to go through a lengthy process of tests that span many months before a diagnosis is made, and this can understandably be an anxiety-provoking time. Others may be told their heart condition is idiopathic and may never receive a clear diagnosis and be left with uncertainty as to what caused their cardiac symptoms, which is, for some people, understandably anxiety-provoking. Each person will take their time to understand their diagnosis, and there is no right or wrong way to do this. I would just encourage you to be patient with yourself and give yourself space to process the feelings that come with it. So in terms of prognosis, which is the likely course of a medical condition, this will be variable depending on the condition and the individual. Your prognosis might be watch and wait if no active treatment is required. It might be contained and time limited. For example, you might have a cardiac event, receive treatment, and then not need any longer term follow-up. It might be ongoing, where you have fairly consistent symptoms most of the time that respond to a consistent treatment plan. It might be relapsing and episodic. For example, the condition might stay stable for some of the time and then be in a more active state other times. Finally, the prognosis might be progressive, in which the condition gradually worsens over time, and this can affect significant life choices like starting a family or work or education. The course of a condition can affect people's sense of control and certainty, and the unknown aspect of this can cause people concern. It can be helpful to have open and honest conversations with your cardiac team if you're not sure about your prognosis and what you can expect from your condition. Some patients find it helpful to plan their health management with their cardiologist in blocks of time if there is quite a bit of uncertainty about their prognosis. When someone has to manage a health condition, they will go through a learning process, and it can be helpful to think of this in different steps. Step 1 is before someone has symptoms or a diagnosis of a heart condition, and they would understandably not have a great deal of knowledge, if any, in this area. Essentially, they don't know what they don't know because there's no reason for them to know, and perhaps therefore they feel fine. Step 2 occurs after someone knows there's a problem, is aware they need to acquire information and make changes, which can take time and energy, and this can be accompanied by anxiety and uncertainty and other difficult feelings. Step 3 occurs when someone has a better sense of their heart condition, but it still feels very effortful to manage it, and this can be associated with frustration, for example. Step 4 occurs when you know all of the above and more without it feeling so effortful, and this may be where acceptance comes in. Step 5 is repeating the first 4 steps each time your heart condition brings on a new challenge. It might feel overwhelming when you're at the start of your journey, when everything is new and surprising. For some people, they find it helpful to research as much as they can and join patient groups and acquire information early on. For others, they may find it helpful to view themselves as a sponge, gradually absorbing information over time so they don't feel too overwhelmed. There is no right or wrong way to approach this. Again, it will be about you and what you need in order to manage your heart condition while still living your life in a way that matters and feels right for you. One of the most common things I hear in therapy is that patients want to accept their heart condition. And acceptance may mean different things to different people. But it can be hard to accept something that makes your life harder or affects how you live your life. Some people, if they had a choice, would not choose to have a heart condition. Some people view it as something that has shaped them as a person and led to experiences that are positive or life-changing. There is no right or wrong way to feel, and acceptance may mean you recognize you have a health issue that you would rather not have, but despite this, you are managing it to the best of your ability and still finding ways to live your life in a meaningful way. So now I'm going to move on to talking about some of the psychological challenges of living with a heart condition. The first one I'm going to talk about is managing change and uncertainty. And one of the things that makes it really hard sometimes to live with a heart condition is that it comes with a lot of change and uncertainty. As human beings, we tend to focus on keeping ourselves safe and ensuring our survival. We avoid threats and the things that might be dangerous for us, and we go towards and welcome things that reward us and make us feel better. Change and uncertainty, very common occurrences for people with heart conditions, can often be viewed and experienced as threats. I remember someone saying to me, "It's hard not knowing if my next heartbeat will be normal or not." And that always stuck with me because I think it highlighted the level of uncertainty that some people feel related to their heart condition. Each person will have their own threshold for uncertainty and navigating change. If this is something that you struggle with, you are certainly not alone. If this is something you struggle with, then I can also recommend some of the advice and strategies from the NHS Every Mind Matters website, which outlines the different steps you can take to help manage change. These suggestions are not specifically for managing a heart condition, but I think the recommendations are helpful and might give you some strategies to help you feel a little bit more in control. Another potential challenge is managing your own and other people's expectations of what you can and cannot do in the context of having a heart condition. It can be hard enough to manage your own expectations. Alongside this, you will also have to manage the expectations of others. Having a heart condition is often described as an invisible illness because people usually can't tell from looking at you that you have a heart condition. People might not take into consideration what it takes for you to manage your energy levels, breathing, heart rate, and blood pressure, for example. If you've had cardiac surgery or been in hospital, it can be hard to accept just how long it can take to build yourself back up again. And other people may assume that since you've had surgery or you're back home again, that you'll be back to your old normal. If you've had a cardiac event that people are aware of or have witnessed, you may find it challenging to navigate questions out of the blue. For example, when you're just trying to get on with your day or drop the kids off at school. It can be helpful to think about your boundaries and what information you do and do not feel comfortable sharing. I sometimes think about being a politician in these instances and thinking about the equivalent of a no comment response, or a couple of sentences to hold in mind if you are asked a question about your health that you don't really want to answer. In this next section, I'm now going to move on to talking about the impact of our heart condition on emotions, thinking, and behaviour. A heart condition will bring with it any and all emotions. Some people report feeling really surprised at how emotional they feel, especially after a diagnosis, a cardiac arrest, heart attack, or before or after cardiac surgery. This is normal and understandable, and it's not a sign that you're not coping or something is wrong with you, but rather an indication that you're going through a significant life event. On this slide, I have included some of the common emotional responses. This list is by no means exhaustive, but it gives some sense of the range of the emotional responses some people experience. Allowing yourself to experience your feelings and not push them away or judge yourself for having them is important, but I appreciate not easy at times. People with a heart condition may also notice changes in their thinking, and one area is attention. People may find themselves paying more attention to sensations in their body and health-related information more generally. Someone once told me, once you tune into your heartbeat, it's very hard to tune out again. For some people, they may find their minds have become overprotective and constantly scan their body for any signs that something is wrong, which can lead to them feeling upset or maybe not doing things that they want to do or that matter to them. If you have any questions or concerns about sensations or symptoms you're experiencing and when to seek medical care, I would encourage you to speak to your cardiac team for guidance, and then try to refocus your attention on something else if your mind is frequently scanning, but there are actually no signs that anything is wrong in that moment. People may also find their minds become more active. Human minds naturally wander, and it's not always easy to focus on the present moment. The mind can become even more active when people are going through a stressful event. You may find yourself thinking about the past, before you had a heart condition, or how it could have been avoided. Ruminating is when people find themselves spending lots of time thinking about the past in a loop. You may have lots of if-only thoughts, which is understandable as you try to make sense of what has happened. You may also find yourself thinking about the future a lot. We call it worrying when people find themselves thinking about the future in a loop and the things that could go wrong. Many patients I've worked with struggle with what-if thoughts related to their heart condition. In part, this is your mind's way of preparing you for potential future difficulties and trying to keep you safe. But again, the mind can become a bit overprotective. The if-onlys and the what-ifs can cause people to feel emotional and may get in the way of how they want to live their life. Conversely, you may find yourself avoiding thinking about your health and pushing thoughts away, only to find they come back again and again. It can be helpful to try and focus on the here and now, in part because it's the only time you have any control over. You may have heard about mindfulness, which is a form of mental training aimed at helping you focus on the present moment, without judgment, by developing the ability to notice and accept your thoughts, but not get hooked by them. I will include some information about mindfulness resources later on. In addition to having an impact on emotions and thinking, we know that a heart condition can also have an impact on behaviour. There are many that I could speak to, but for the purpose of this presentation, I'm going to focus on relationships and health behaviours. In terms of relationships, it's common for people to say their health issues affect their relationships to varying degrees. This may mean bringing people closer together, but for many people it can cause tension in the relationship because of the ripple effects that both parties or all parties are navigating at the same time. Some people after a cardiac event can find socialising can be challenging. This may be because of the noise and activity that can feel overly stimulating, or because they've been told to reduce their alcohol use, which can make socialising feel difficult, or because people keep asking about their heart condition, which feels uncomfortable. If this is something you find difficult, it might be helpful to think about socializing in a way that feels right for you and communicating this to the people closest to you. Some people may find their roles change at work and at home, which can be associated with difficult feelings if someone cannot look after their children or the house in the way that they used to, or if they have to accept help from others, or if they cannot financially contribute in the way that they used to. We also know that the emotional impact of having a heart condition can make intimacy harder. It's common for people to worry about the impact of sex on their heart rate or breathing, or because they are struggling more generally, they may have a reduced libido. It could be because people feel more self-conscious due to surgical scars or their ICDs, and this can affect confidence and the desire to be intimate. We also know that cardiac medications can cause erectile dysfunction. I appreciate talking about sex can feel uncomfortable, but it can also be a really important part of many relationships, and I would encourage you to seek support if this is an area that you are struggling with. In terms of health behaviours, some people, depending on their heart condition, will be advised to exercise more, whilst others may be advised to exercise less. Either way, this can bring up difficult emotions depending on your relationship with exercise. We know that many people with cardiac conditions have difficulty sleeping, and this can be because of symptoms or worry. I would encourage you to speak to your GP if you are struggling with sleep, and I have included some resources later on. You also may be advised to make lifestyle changes, and these changes will ultimately help your health, but it can feel overwhelming to do them all at once. If this is the case, it could be helpful to focus on making one change at a time. Taking medication often requires an adjustment, and it's common for people to dislike having to take new medications as it's a frequent reminder of the difficulties that they're facing. Over time, medication will hopefully get easier for you to manage, but in the early stages, it's okay if it feels difficult. And I would encourage you to speak to your cardiac team if you have any concerns. Some people find themselves searching for health information online, often for guidance and reassurance, which is understandable. And sometimes this will be helpful, but other times less so. I remember someone saying to me, "You plus Google is not a doctor." So if you find yourself getting anxious when online, I would recommend stopping or reducing this behaviour. If you have medical concerns, then I would recommend speaking to your GP or cardiac team. And if you do go online, I would recommend limiting it for about 10 minutes, putting a timer on your phone, and limiting how many links that you click on during that time. Some people find that they want to avoid all reminders of their heart condition and may not follow medical recommendations. Avoidance is a really common way of coping with difficult feelings, and in part because it works in the short term at least, but in the long term it can create more problems. If this is something that resonates with you, you are not alone, but I would encourage you to seek support if you feel that emotions are getting in the way of how you look after your health. So this final section is going to be about the support that's available. Some people are not sure when they should seek support for their mental health. I would recommend seeking support if you are experiencing emotional distress that is bothering you, getting in the way of managing your health, or affecting your day-to-day functioning or how you want to live your life. Support comes in many forms, and it's usually a combination of lifestyle behaviours, feeling connected with others, and having ways of managing difficult thoughts and feelings that helps people manage their mental health. At times, more tailored psychological support can be helpful, and I will talk through a few options in the coming slides. If you're not sure what support you need, I would recommend speaking to your GP. In terms of self-help, you can access a large range of evidence-based self-help books from the Reading Well website. You can purchase these online or access them via your local library. Many areas in the UK provide patients with access to SilverCloud, which is an online interactive platform offering guided computerized cognitive behavior therapy. The service is available for free to individuals who are not receiving any mental health support and who are registered with a GP in Bristol, North Somerset or South Gloucestershire. Speak to your GP about whether you have access to this if you do not live in one of these areas. It is not specifically for people with long-term health conditions, but the principles utilised in the programme could be helpful for managing difficult thoughts, feelings and behaviours. If you want to access a range of one-to-one and group psychological support for a variety of mental health difficulties, including living with a long-term health condition, you can do so by self-referring to your local NHS psychological therapies provider. I have listed a few on the coming slides. If you live in an area not covered, then please speak to your GP about the right service for you. These are the details for Vitamines, which covers Bristol, North Somerset and South Gloucestershire. These are the details for Bath and North East Somerset. These are the details for Swindon. These are the details for Wiltshire. Psychology provision is available via the following cardiac teams within the Bristol Heart Institute: the Inherited Cardiac Conditions team and the Adult Congenital Heart Disease team. If you would like to access support, please speak to your cardiologist or the clinical nurse specialist who will be able to refer you. And in terms of additional support and resources, I've listed a few more on this slide, which include support for fear of needles, sleep hygiene, emotional support and well-being for cardiac rehab, mental well-being tips, which includes information about mindfulness, grief and loss, relationship support, obviously the British Heart Foundation, and well-being toolkits for adults that have been developed by our trust. So I just want to close with a few final thoughts. There may be ripple effects of your heart condition, but you are not your heart condition. It's common for people to take time to adjust to their heart condition and for it to have an impact on thoughts, feelings and behaviours. There are things that you can do to look after yourself, and there is support available to help you navigate the challenges you may be facing. Thank you for listening, and take care.